This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, well, I'll dive right in as our program director is getting on. So we are Washington University in St. Louis. These are beautiful pictures of our medical campus in the bottom left and bottom right, and then the undergraduate campus in the top left. Go to the next slide. So we have two categorical positions. These are pictures of our current categorical interns who are fantastic. We do 6 months of internal medicine, 2 months of neurology, 1 month at our inpatient rehab hospital, the Rehab Institute of St. Louis, or as we affectionately call it, TRIZL. And then we have a smattering of other rotations that are very PM&R relevant. The picture in the bottom right is the main hospital where much of the intern year is spent. For PGY2 through PGY4 year, it looks probably fairly similar to other presentations that you have already seen. We have a variety of different inpatient settings, including the Rehab Institute that I mentioned. We have VA hospitals that we work at. St. Louis Children's Hospital is also integrated into this medical campus, and so there are pediatrics rotations. And then our consult service. WashU is a large tertiary care center for a lot of different specialties, and so our consult service sees a lot of different pathology. On the outpatient, we have a very large musculoskeletal and sports medicine group. There's about 10 of us, which is one of the bigger ones in the country. And there's a lot of rotations related to that, as well as neuromuscular medicine and our neurorehabilitation rotations. Here are pictures from the Rehab Institute of St. Louis. Our faculty and staff in the bottom right having a good day at the hospital. It is a freestanding acute rehab hospital with 96 beds. It is a private and public kind of partnership between Washington University and then Encompass Health. I'm going to turn it over to one of our chief residents, Alan, to speak a little bit about the experience at TRIZL.
Thanks so much, Nate. So here are, this is one of our services. So the brain service, it's a combined stroke and traumatic brain injury service. We see people with polytrauma from motor vehicle accidents, tumors, neurosurgery, all different types of strokes as well. We have a structured care unit there as well. This is primarily run by PGY 2s through 4. We have 4 months as a PGY 2, 4 months as a PGY 3, and 2 months as a PGY 4. In here, you see some teaching in our workroom and the rest of our attendings down at the bottom. For the brain service and also spinal cord injury service, we take call from home. You're only on call while you're at the Rehab Institute, which is about a total of 10 to 11 months, depending on kind of how your rotations fall. So here's a picture of our a lot of our residents trying out all the different wheelchairs in the TRIZL gym. We all on our SCI unit, we have amputees, spinal cord injuries, post-surgical spine patients as well. A lot of different pathologies from spine tumors, myelopathy, neuropathy patients. We have a pretty robust limb loss program at WashU as well. This service is also 10 patients per resident. and primarily 2s through 4. Again, you do about 4 to 5 months as a 2, and as a 3, and as a 4, you do 1 to 2 months, kind of depending on your schedule. So our consult service, we just hired a new consult attending. We have a very large hospital with a lot of consult needs. And so we see patients for spinal cord injury, from trauma, from TBI, limb loss, stroke, across neurosurgery, ortho, really all over the hospital. And it's, I think one of the more exciting and rewarding services that we have. So over at the VA, we also do 1 to 2 months at the VA General Service. Here we're at Jefferson Barracks, which is a spinal cord injury central site for the VA. We do inpatient and outpatient on this rotation, so you get a good amount of EMGs there, as well as concussion clinic. You can get some procedures in as well, and then you also maintain a list of inpatient patients. Here, this is, I think, a little bit prior to COVID when things were a little bit more open at the VA. I'm sure some of you are aware of that. The VA is closed for a lot of these activities, but they have a pool. There's people kayaking. You can go snorkeling, scuba diving. Here's people playing bowling with assistive devices. The spinal cord injury service, so that's actually me in the top left as a bright PGY2. So on this service, it's a little bit more inpatient heavy. You also get to do some Botox and baclofen. It's a great program since there are a lot of resources for the patients and just kind of veterans in general. So we do a lot of rec therapy. There's a lot of different events around the country that we can be a part of and travel with if you're interested in that. So here's our pediatrics rotation. We do about one to 2 months per residency. It's an outpatient based and consult service. You see kids over at the main hospital in general rehab, CP, neuro-oncology, O&P, and you also get a handful of procedures as well with Botox and ultrasound. And our two pediatric physiatrists, Dr. Levin and Dr. Smith, are great educators and teachers. I think I see our program director on.
Yes, I'm on. Happy to do a few slides.
You want me to advance and continue?
Sure, it'd be great. Sorry about that. And then we have a second pediatrics rotation out at Rankin Jordan, which is a hospital out in the suburbs that is totally designed for pediatric rehab. The facilities there are amazing in terms of what they have for the kids that are out there. They take on some of the most challenging patients, and honestly, it's a very highly ranked rotation from our residents, in that also the whole focus is on rehabilitation. They have general pediatricians that help care for some of the other medical issues. And then we have a whole array of clinics throughout the residency. We call it the Neuro Rehab Clinic. This is on our main campus, and the focus here is on patients that come in after they've had their inpatient rehab stay, or patients with chronic injuries such as brain injury, spinal cord injury, amputee clinic. There's Botox procedures that are done, and kind of the whole gamut. And then we do a fair amount of electrodiagnostic testing. We're actually going through a little bit of a switch in how we do that. But right now, our electrodiagnostic rotation is with our MSK attendings. We have nine attendings, and most of them do electrodiagnostic studies, not all of them. We're based in orthopedics, so we get kind of a whole array of the routine kind of carpal tunnel radiculopathies, but we also get a lot of more complex nerve injuries, brachial plexus injuries. So kind of runs the gamut. We also do some ultrasound combined with the electrodiagnostic testing in cases where it's not clear on the EMG.
I can jump in on a point related to that. So Dr. Metzler and I help run the complex nerve clinic out of Washington University. We do that in conjunction with 2 orthopedic trained hand surgeons who are nerve specialists. And so we see a lot of patients pre-surgically as well as post-surgically to help diagnose the etiology of their nerve injury and then help guide surgical management. It's one of the coolest clinics, I would say, that I participate in. So.
And then we have a rotation dedicated to pain management. So we've been fortunate to work very closely with our anesthesia colleagues who run a pain management clinic on our main campus. They also have some satellite offices. Fortunate enough that a couple of our residents have gone into pain management and actually done the fellowship over in anesthesia. One of them is on the top right there. Dr. Justman did our residency a few years ago. She stayed on and did the fellowship, and now she has stayed on with the anesthesia pain management team with us, kind of a subspecialty in pediatric pain management. High volume of procedures in this. Any procedure that a pain management physician might do, stimulators, cervical injections, you name it, it's done in this clinic.
Yeah, and I would just chime in and say, I think one of the strengths of this rotation is that we really do get to drive the needle and get hands-on in this clinic. It's not just fellow-based where we kind of are standing in the corner watching. It's a lot of hands-on procedures and kind of working in tandem with the attendings.
We also have a number of MSK and sports medicine trained physicians, as Dr. Metzler mentioned. This is a picture of our group here. We have 4 different MSK rotations that each resident will do multiple times over the course of their residency. I would say that we're pretty high volume with regards to procedure numbers. Alan probably could speak to that as in comparison to other programs, but we set up these rotations in a sort of graded fashion so that some of them are more clinic-based and more fundamental of fluoroscopic guided procedures, and then other ones are more advanced with fluoro procedures, such as with Dr. Decker, who is in the top right, and then like myself with more advanced ultrasound procedures. So if you have any interest in musculoskeletal sports medicine or pain medicine, I would say that we would serve your interests well with our volumes and our rotations. We also have a sports medicine fellowship that's associated with our residency program. Many of the faculty who participate in the residency program also help run the fellowship. And then we also have a NAS fellow who is part of our program as well. So we have 2 fellowship spots related to MSK.
Yeah, and just to chime in, I think if MSK and pain is your interest and procedures are something you're interested in, it's not uncommon to get upwards to 200 performed procedures in fluoro and ultrasound at our program. And I don't think we're going to touch on it specifically. So in that top picture, there is us with the ultrasound. That's part of our ultrasound club, which runs about once a month. And it's a group of about 3 or 4, 2 different sessions on a Saturday with an attending. That's Dr. Olafson working with 2 of our residents, which is really invaluable about just going through different body parts from wrist to elbow to shoulder to hip to knee to ankle, and kind of, and working through just diagnostic testing and how to kind of prepare for any of the MSK rotations.
There's also a number of sports medicine relevant experiences. So we are part of the team physician group for Washington University, which is a Division III school. We cover soccer, sometimes basketball. We also cover Lindenwood teams such as like swimming and diving, hockey, gymnastics. and a variety of high school football teams. Periodically, other events come up that we participate in. One of our faculty members is going to be one of the team physicians for the upcoming St. Louis FC MLS soccer team. That's an exciting opportunity as well. And then one thing that is unique about the way our department handles orthopedic injuries is we have what is effectively an orthopedic urgent care called the Orthopedic Injury Clinic. So if someone sprains their ankle, thinks they broke their wrist, dislocated their finger maybe, and they don't want to go to the emergency room, they would go to the Orthopedic Injury Clinic. And so our residents, as well as our fellows and our faculty, all work in that. And so there's a high density of acute orthopedic injuries that we see as part of that clinic.
Hello.
Here are just some pictures from our musculoskeletal and pain and sports medicine curriculum. We have fresh frozen cadaver injection practice course in the top left, diagnostic scanning courses in the bottom left and bottom right, and then suture practicing in the top right. A little bit more about the didactics. We run our didactics curriculum on an 18-month cycle. Each one of these are faculty led and in close collaboration with our chief residents. Within a given lecture block, say brain injury, there will be faculty given lectures, there'll be case presentations by residents, journal clubs, and also critical thinking sessions where we work through a typical clinical case, applying the content knowledge that was just learned. There's also research curriculum as part of the didactics, and then professional development curriculum as well. In terms of research opportunities, we have an abundance of those. So we have pictures here of former residents who are presenting at a variety of different conferences. We also have an on-site research presentation day. We have a faculty-led resident research group that's led by Dr. Abby Chang, and then also Dr. Chang leads our research curriculum on how to assess the literature, how to design a study, assess statistics, etc. Speaking of, here is our resident research group. We have Dr. Chang, who is the lead of that in the bottom right, and then Dr. Grover and Dr. Hunt are also featured there, who do musculoskeletal and sports medicine in the bottom left, and then limb loss and neuro rehab sort of in the center picture. All right, I'm going to turn it over to Alan for what it's like living in St. Louis.
Yeah, now I know we're kind of coming up close on time. So we are located in St. Louis, right on the border of Missouri and Illinois. I personally am from Chicago, and that's about a 3.5, 4-hour drive. On the bottom left is a really nice shot of the entire campus. The Barnes Jewish campus, WashU, kind of spans multiple blocks in St. Louis, and the other part of that picture is Forest Park, which is probably my favorite part of St. Louis. It has everything from, a 10K running track to a museum, to multiple museums, to a boathouse, to a golf course, to a ice rink. It's a great place to kind of unwind right next to the hospital. A lot of us live very close to the hospital and in vicinity to this park. And then the bottom right is our undergrad campus, and then what St. Louis might be known for outside of Missouri for the Arch in the top right. Here are just some other pictures of Forest Park. So there's sledding near Art Hill. There's a zoo as well. There's an ice rink. There's a large outdoor theater in the top right picture there. And just an overview shot of St. Louis. Here's our wellness in picture form. So in the top left, every year we try and get a couple big outings together. Here we are at Top Golf all together. Our program's about 14. I think this is almost everyone and their families and their significant others and partners, as well as other smaller, events. Informally, we like to get together after work on the weekends, grab dinner, go see movies, go on runs together. There's a lot of Physiatry, tends to lean towards the athletic type, and our program is part of that. We have a lot of runners and athletes that love to get together and do athletic things like play on soccer teams, volleyball, go on runs and marathons. Here are just some other pictures of other community service things that we do. We've been part of helping out with skiing and wheelchair basketball, water skiing, which is not pictured here, different DASA events, which is the Disabled Athletes Sports Association. That's pretty prominent in the St. Louis area and a great resource for some of our patients out in the community. If we have time for questions, happy to take those as well.
I think we have a minute or two for questions. If anyone has any, you can drop them in the chat.
So I see there's a question in the chat about MSK ultrasound and RMSK certification. Certainly that's something that we would support. A number of our faculty members are RMSK certified. I would say that the majority of the 10 MSK sports faculty do ultrasound. Some of us do more typical MSK things. Some of us also, like myself, do a lot of neuromuscular ultrasound. So there's a lot of opportunities for that. Also, we have structured MSK ultrasound curriculum that you'll experience at least twice during a residency program because it's on an 18-month cycle. And then the ultrasound club occurs more frequently than that.
Yeah, I would just point out too that we have 4 outpatient MSK locations, and all 4 of them have an ultrasound machine.
I don't see any questions. So thank you so much, everyone, for joining us tonight. Thank you to all the other programs too who are hanging out in the background. And thank you all for hanging out for the last session of PM&R Scholars. Good luck on the match, and hope this is beneficial to all of you. All the contact information for everyone today will be available on our website and our social media. So thank you so much, everyone. Have a good night.
Take care, everyone. Good luck.